presentation on the injectable anesthetics. Injectable anesthetics constitute the cornerstone of drugs used to provide unconsciousness and immobility in dogs and cats. These drugs are used to allow handling of animals for diagnostic and surgical procedures. They also provide a rapid means of producing sedation or anesthesia in veterinary patients. We use injectable anesthetics to induce anesthesia, meaning this is how we get the animal from pre-med or pre-medication, and we sedate the animal until it becomes unconscious. The injectable anesthetics don't necessarily provide analgesia or pain control or muscle relaxation. We are just trying to produce unconsciousness in these animals. Injectables are used with other agents and they are given to effect. So we use other agents, anesthetic agents, in order to provide a smooth induction of our injectable anesthetics. Again, they are administered to effect. That means that we don't just calculate the dose and inject it to the animal, but rather we titrate it. Now, it is important to be aware that the adverse effects of the drug or the anesthetics are dependent upon the dose and the rate of injection. Titration of the dose according to the individual needs by administering small IV bolus doses to effect may reduce the intensity of such effects but does not ensure complications will not occur. So what are the common examples of injectable anesthetics in veterinary medicine? So we have the barbiturates, we also have the propofol, etomidate, and alpaxalone. For small animals, particularly in dogs and cats, there are 5 injectable anesthetics that are currently more employed for anesthesia. These are the propofol, alpaxalone, etomidate, ketamine, and tiletamine sulacipam. So when we are going to compare them, propofol, alpaxalone, and etomidate are general anesthetics and induce unconsciousness. For ketamine and tiletamine sulacipam, of course, they are particularly tiletamine because sulacipam is a benzodiazepine. Tiletamine and ketamine are dissociative agents, meaning that they induce a state of catalepsy. So of the above anesthetics, propofol and etomidate are exclusively administered by IV injection. We also have alpaxalone, can be administered IV or SC. And for the dissociative anesthetics, ketamine and tiletamine, they are usually administered IV or IM. So again, our dissociative anesthetics, ketamine and tiletamine, usually induce a state of catalepsy. So basically, when we say catalepsy or cataleptic state, that is characterized by trance or seizure with a loss of sensation and consciousness, accompanied by rigidity of the body. So the difference between a mere unconsciousness that is produced by for example, our propofol, our general anesthetics, is that for dissociative anesthetics, for catalepsy, there is a state of the body being rigid. So we'll start with the barbiturates. So the barbiturates can be classified according to their duration of action. So we start with the ultra short acting barbiturates. So under this, we have thiopental, methohexital, and thiamylal. So they are used for dogs, cats, and horses to induce general anesthesia. For the short-acting barbiturates, so under this, we have the pentobarbital. Pentobarbital, at one time, was commonly administered to provide general anesthesia, particularly in small animals, but it is now infrequently administered for this purpose. So currently, pentobarbital, or the combination of the drugs with pentobarbital, are approved. These are preferred method for euthanasia of dogs, cats, and other small companion animals. So again, the pentobarbital has long been used before as a general anesthetic agent, but it is now not currently applied for that purpose because of its because this drug is easy not to overdose. In terms of their therapeutic index, pentobarbital has a very narrow therapeutic index, going from effective dose to fatal dose, and there is a very small margin between the two. It turns out that this drug is really great to euthanize animals. So that is one of the major use of this drug nowadays. Pentobarbital is used for humane euthanasia for animals not intended for food, and IV injection is the preferred method for euthanasia of dogs, cats, other animals, and horses. Pentobarbital is also used to treat epilepsy, secondary to convulsant agents such as strychnine, or to tetanus. So, for example, if we have animals having seizures that we can control, we can put them in constant diffusion rate with pentobarbital. Pentobarbital is still used in laboratory animals to induce general anesthesia and for epilepsy. So it can also be administered IV slowly. They can also be used for C-section. Of C-section is not recommended because of fetal respiratory depression, and this must also be used with caution in cats. Another classification of the barbiturates are the intermediate and the long-acting. The duration of action. Barbiturates can also be classified according to their chemical structure. We have the oxybarbiturates. Now, under this, we have the phenobarbital, pentobarbital, and the methohexital. Again, the phenobarbital is used to treat seizures and epilepsy. Seizures in epilepsy. For the thiobarbiturates, so under this, we have the thiopental and thiamylal. So, one concern with thiopental is it should not be used in certain breeds of dogs such as sighthounds and greyhounds. So this is a greyhound, and we should not induce anesthesia in greyhounds or sighthounds with thiopental because one characteristic of thiopental is that it redistributes in fatty tissues such as the uh, adipose tissue or the fat. These breeds don't have much fat, as seen in the picture, and basically thiopental gets redistributed from fat. So if you don't have much fat to redistribute, the drug, it is very easy to overdose the drug. That is why thiopental is not safe for these species. This is the MOA of the barbiturates. So the barbiturates particularly act on the GABA receptor, as shown in the figure. What it does in the GABA receptor is that it will activate the receptor, opening the chloride channel and increasing the duration of GABA-gated channel opening. When it opens the chloride channel, of course, there will be an influx of chloride ions to the cell. It will result to more negativity of the cell, resulting to hyperpolarization and resulting to the depression of the CNS. So the barbiturates, just like any other sedatives, such as benzodiazepines and other sedatives and anesthetics, will act on the GABA receptor. Like any other anesthetics, so barbiturates will cause CNS depression. And of course, the CNS depression is brought about by the stimulatory effect on the GABA receptor. And of course, there is a loss of consciousness because this is a general anesthetic. For determination of action, so characteristic of the GABA receptor barbiturates is that it is highly lipid soluble, particularly that of thiopental. So it is highly lipid soluble. It rapidly enters the brain after a single IV injection, and it has a marked and rapid anesthetic effect. Now again, because thiopental is an ultra short acting barbiturates. Um, so the effect of the barbiturates, or particularly that of thiopental, will end within a few minutes after the drug is redistributed. So the barbiturates, particularly the thiopental, of course, will undergo metabolism, excretion, or it can be distributed to the other parts of the body. So, for example, in the case of the thiopental, the drug will be redistributed to the more slowly perfused fatty tissues. So the thiopental is then slowly released from the fat storage, maintaining the sub-anesthetic plasma levels. The pharmacokinetics of the barbiturates, so the PK of the barbiturates will affect its potency, its onset, and duration of action. One of the factors that has to do with the important factor that will influence the pK of the barbiturates is of course the ionization. So under this, we have the polar or the ionized and the nonpolar forms of the drug. So of course, for the nonpolar forms of the drug, it can readily pass through the cell membrane. So one of the factors that will influence the nonpolar forms of the barbiturates is the acidosis. When there is acidosis, there will be an increase in the amount of the nonpolar drug, so it will increase the nonpolarization. Of course, when there is increase in the nonpolar forms of the drug or the non-ionized form, it will also increase the drug amounts to the brain because it will make the drug more lipid soluble. There is an increase in the amount of drug to the brain. There is also an exaggerated patient response, of course, when the drug will enter the CNS. There's more drug that gets into the brain if the animal is acidotic. So lower dose of the drug is required to anesthetize an acidotic animal. Factor that will influence the PK of the barbiturates is the protein binding. So barbiturates are said to be highly protein bound, particularly to albumin and other plasma proteins. Of course, when we are going to compare the two groups, we have the thiobarbiturates. They are more highly protein bound compared to the oxybarbiturates. So the degree of protein binding of a drug is influenced, of course, by the physiologic pH and the disease states, which alter the absolute amount of protein. So it is the free or the unbound form of the drug that will eventually enter the brain through by passing through the blood-brain barrier. So of course, for hypoproteinemic animals, of course, the hypoproteinemia will result to the more available free form of the drug in the bloodstream. So when there is more free drug in the bloodstream, it will also result to more drugs that will be able to reach the brain. A normal drug dose may produce prolonged unconsciousness or death. Again, this is due to the drug being highly lipid soluble and being able to readily cross the BBB. The lipid solubility or the partition coefficient. So this is the tendency of the drug to dissolve in fat, oil, and lipids. So this will also affect the ability to penetrate the cell membrane fatty layer. So for the short-acting or particularly for the ultra-short-acting drug, they have a high lipid solubility. They also have rapid tissue redistribution as a result of being highly lipid soluble. For the short-acting drugs, of course, they have moderately lipid soluble, and for the long-acting drugs, they are low lipid soluble. So for the barbiturates, they dissolve easily in fat, meaning that they are highly lipid soluble, particularly for Thiopental. Therefore, barbiturates have ready access to the brain because they can cross the blood-brain barrier easily. Also, they can dissolve into the body fat, they can accumulate and re-enter the bloodstream later. Barbiturates are one of the drugs, particularly anesthetic drugs, that undergo a significant tissue redistribution. So the drug is usually administered by IV, and after that, now because of its high lipid solubility, it is distributed fastest to the vessel-rich tissues. The drug will enter the tissue based on its lipid solubility. Particularly, it enters the brain because, again, it is highly lipid soluble. The effect occurs when the drug is in the tissue. So basically, its main effect is CNS depression. The drug leaves the tissue and the blood level drops. So this is the time that the animal will recover from being anesthetized or being unconscious. Then the blood will also be carried out to the other tissues. So this is the time that the drug will be redistributed to the other tissues aside from the brain. After that, after some time, the drug will be released by tissues and eliminated in the body. It shows the distribution of Thiopental from plasma to the vessel-rich group, or the VRG, as represented here. Again, for the VRG, it represents the brain, the viscera, the heart, liver, kidney, and the endocrine glands. Now to the muscle group, and we also have here the fat group. So the y-axis represents the percent of the dose of the drug, Thiopental, and the x-axis represents the time after the administration in minutes. So a characteristic of Thiopental is that it is greatly lipid soluble, and it also has highly non-ionized. And of course, when we are going to administer the Thiopental by IV, so what happens is there is a 100% bioavailability. After some time, after a few seconds, there is a decline in the plasma concentration of thiopental. So again, thiopental is highly lipid soluble, so that it readily enters the brain, and it produces a sedation at this time. It produces unconsciousness to the animal. There is also a peak in its distribution at about less than 1 minute. So it has now again, it is an ultra short acting barbiturate. It has a high effect. Its onset of action is considered to be fast, again because it is highly lipid soluble. So at this time, it accumulates in the well-perfused tissues in the body. Again, we have here our brain, resulting to, of course, CNS depression. After some time, what happens is, after it leaves the brain, what happens is the other drugs will go into the less perfused tissues in the body, such as the muscle. And also after some time, it will also accumulate in the fat group, which is, of course, a less perfused tissue in the body. So as you can notice here, the amount or the concentration of the drug in the brain will decrease at this point, or about 10 minutes after the drug is administered, and about after or beyond that, there is a decline in the concentration of the drug in the brain or the vessel rich group, and there is also a gradual increase in the concentration of the drug in the fat group. So the clinical relevance of this is that, um, the pharmacokinetic profile of the Thiopental will correlate with the clinical experience. So patients typically lose consciousness at this point at about 30 seconds. So the patient will lose consciousness because, again, the Thiopental will readily cross the blood-brain barrier and enter the brain, causing CNS depression. And the patient will awaken at about 20 minutes after the administration, again because the drug will now be distributed to other parts of the body aside from the brain, and that is the muscle group and the fat group. So this is the diagram showing the tissue redistribution that the barbiturates undergo after it reaches the brain. So these are the organs with, considered to be vessel-rich group, the brain, heart, liver, kidney, and the endocrine glands. So they are considered to be vessel-rich group, and they are well-perfused tissues in the body. So the Thiopental readily enters, the brain and the different vessel-rich group in the body, so that it has a faster onset of action. After some time, the drug will be redistributed to other parts of the body, such as the less perfused tissues, the skeletal muscle, and the fat. And at this time, when the drug will be redistributed, so the animal will lose unconsciousness because of this tissue redistribution. The ultra short acting barbiturates will vary, in their redistribution. So in the case of thiopental, so thiopental is an ultra short acting barbiturate. Again, it is redistributed to the muscle and the fat, and after it accumulates in the brain and the viscera. So in the muscle and the fat, it is where it is slowly released now from the body. So the clinical significance of this is that continuous or repeated dosing of the drug may lead to full muscle and fat, meaning that it accumulates in the muscle and fat and resulting to a prolonged recovery from anesthesia. In the case of methohexital, so it is also an ultra-short-acting barbiturate. It is also redistributed to the muscle and fat, but it has a faster release. So in the case of methohexital, unlike that of thiopental, the muscle and fat don't get full. So there is no prolonged recovery from anesthesia with continuous or repeated dosing. Of phenobarbital, a long-acting barbiturate. So sustained effect is caused by the slow uptake and release from the brain. The release is dependent on the kidney excretion, which is slowest. That is why it is a long-acting barbiturate. In the case of pentobarbital, so pentobarbital is a short-acting barbiturate, the brain levels decrease based on the liver metabolism, and it has it is faster than the kidney excretion. Why do we use barbiturates? So we use barbiturates in order to induce anesthesia. we need them to allow intubation. So if you're using Thiopental to an animal, we usually have somewhere in the vicinity of 6 to 8 minutes before they are going to wake up. We give it that it should be enough not to let us intubate the animal. So it will allow no intubation, particularly for thiopental and methohexital. We also give enough time to intubate to get the animal onto gas anesthesia, which is going to keep or maintain the animal to being anesthetized. In certain cases, some barbiturates like methohexital and pentobarbital could give them for repeated doses or concentrate infusion to keep them under anesthesia. Of course, we don't do this with thiopental because again, the thiopental will build up, it will accumulate into tissues, particularly in muscle and fat, saturating the tissues, and the animal is not going to recover well or potentially develop an overdose. So that is of course very true for thiopental. We can also use thiopental alone or in short procedures, particularly very short procedures, because remember that this will wake the animal after 6 to 8 minutes. So technically, it is always recommended to intubate the animal while being unconscious because of the rapid duration of action of this particular anesthetic. Effects of the barbiturates, we'll start with the CNS. So when it gets into the brain, the barbiturates will cause mild sedation to unconsciousness depending on the drug and the dose. There is also possibly excitement at low dose. When we're giving this IV, because it can cause excitement at a low dose, what you want to do is to bolus to a certain dose. So usually we bolus about a third of it and then titrate the rest of the drug. So the bolus will get you through the possible excitement phase, and then you can just use it to effect. For the cardiovascular system, just like any other barbiturates or anesthetics, it can cause cardiac depression. In the case of the thiopental, it causes autonomic nervous system imbalance. There is also an increase in the cardiac sensitivity to epinephrine, and it may also result to cardiac arrhythmias. These are the effects of the barbiturates on the respiratory system. So what it does on the respiratory system, just like any other anesthetics, is that it will decrease the respiratory rate, and it will also cause the depression of the tidal volume. So when we say tidal volume, that is the amount of air that moves in or out of the lungs with each respiratory cycle. In the case of the thiopental, so one of the important consideration is that it can cause brief apnea. So when we say apnea, that is cessation of breathing, or the animal will stop breathing after for a brief period of time. So that should be noted with thiopental. In the case of pentobarbital, so what it does is that it can cause shallow breathing. So of course, shallow breathing can result to respiratory acidosis and also poor tissue oxygenation. So of course, we have to take note that pentobarbital is currently the drug of choice for it is a euthanizing agent. These are the other effects of the barbiturates. So barbiturates can cause sneezing, laryngospasm, and coughing. This can be due to salivation, and this can be prevented with anticholinergic drugs. So anticholinergic drugs are our atropine and glycopyrrolate. For its effect on the GIT, so there is an initial decrease in the GI motility, followed by later increase in the GI motility. There is also an incomplete muscle relaxation. These are the adverse effects of barbiturates on the cardiovascular system. So it can cause cardiac arrhythmia, particularly in dogs, that has been administered with thiopental. So thiopental has an approximate arrhythmogenic incidence of 40%. So it can cause VPC, or ventricular premature contractions. There is also ventricular bigeminy. This is the most common arrhythmia seen, and this is considered to be transient, and this can respond with additional oxygen. We also have the pre-oxygenation. So we like to pre-oxygenate our patients 3 to 5 minutes, especially those patients that are considered to be brachycephalic dogs. We can also bag the patient 2 or 3 times after intubation. So these are breathing bags. Now these are part of the anesthetic machine, and this will supply the anesthetic gases, and this will also serve as a means for manual ventilation for the patient. These are the adverse effects of the barbiturates on the respiratory system. So again, there is a dose-dependent depression of the respiratory system. There is also an initial apnea that may last about 1 to 2 minutes. Now, so at this point, the animal may need a support because it can alarm of course, the owner. For in the case of the cesarean section, so this can cause respiratory depression in the neonate after the cesarean section. Important adverse effects of the barbiturates. So, of course, it can cause exaggerated potency in sighthounds, critically ill patients, hypoproteinemic, or acidotic patients. So, care should be taken in the case of sighthounds, as they, of course, take longer to recover because, of course, they don't have much fat. They are lean animals, so they may be they have minimal fat, or because they metabolize the drug differently. So in the case of the acidotic patients and hyperproteinemic patients, this drug is often contraindicated because again there is exaggerated potency, so that they require lower doses to produce an anesthetized state due to the increase in the unbound and the, of course, an ionized form of the drug. If you give this accidentally outside the vein, now in perivascular injection, it can cause tissue necrosis and sloughing, meaning that the tissue may shed or cast off. It really becomes painful and, of course, awful to the patient, and you want to give this through the IV catheter. So this can be treated with saline, with or without lidocaine, and you can also dilute the barbiturate solutions. Barbiturates can cause excitement during induction. So these are the probable causes why there is excitement. One of that is when you are giving the drug too slowly or a very slow rate of administration. Uh, Maybe you get to stage two and you didn't give enough drug to pass the stage two, which is the excitement part of the anesthesia. Another reason is the insufficient concentration of the drug in the brain to induce stage 3 of anesthesia. And of course, you have to administer more drug in order to pass the stage 2 of the anesthesia. There is also excitement. There can also be excitement during recovery. So one of the factors that we need to consider is that if the animal was excited going down of anesthesia, it will probably be excited also waking up or recovering after the anesthesia. So there can be paddling and vocalization during recovery. So that is when when you have not really given the proper amount of the pre-anesthetic agent before you are inducing the anesthesia. So to counteract this, we can give diazepam. So diazepam is, of course, a tranquilizer that can help to counteract this excitement. And you can also prevent this with uh, the proper choice of the pre-anesthetic medications. Interactions of the barbiturates, so it can enhance the activity of the muscle relaxants. It can also increase the hepatic enzyme activity, particularly when you are using it for a prolonged period of time. And it can shorten the duration of activity of the drugs that are metabolized in the liver. Examples of this are the opioids and the diazepam. For Thiopental, so Thiopental is again a short-acting barbiturate. So it is indicated for small animals and horses. It has a rapid onset but brief duration of action. So again, no, it is rapid onset because again it is highly lipid soluble, but it has a very brief duration of action. Remember that in the case of Thiopental, there is an initial unconsciousness that lasts only a few minutes, and this will be followed by redistribution to the tissues, i.e., we have the fat and the muscle. And then we have also a slow recovery from there. So the slow recovery will take about 1 to 2 hours. It is a crystalline powder in multivials, so you need to reconstitute this with cereal water, normal saline, or 5% dextrose in water. It is available as a 2 to 2.5% solution in small animals and 5% solution in horses. Um, for the shelf life of the Thiopental, so it is about 1 week refrigerated or 3 days at room temperature. And of course, you have to uh, it is not to be used when there is a precipitate that is present. Dose of the Thiopental, so of course the dose will vary according to the protocol and the procedure that you are going to use. An important consideration is that in debilitated animals, you really have to reduce the dose of the drug by about 80% for these animals, no, debilitated animals. This is the same also with hypoproteinemic and acidotic animals because in these animals there is an increase in the proportion of the drug that is ionized. Um, you should also reduce the dose in heavily sedated animals. So for heavily sedated animals, so of course you have done a lot of pre-medication or pre-anesthetic agents. So you are going to decrease the dose of this thiopental. Of course, this drug is given to effect and repeated doses are cumulative, leading to prolonged recovery. So this drug is not advised to be given by repeated doses because again, it accumulates in tissues, particularly in the fat and the muscle. This should also not be used for anesthetic maintenance, again, because it is accumulating. Now, there are other drugs that will not accumulate. For example of that is propofol, another type of general anesthetic. For ultra short-acting barbiturate is methohexital. Now, it can be useful on the unfasted animal. It has a rapid induction and intubation. It has a decreased risk for vomitus aspiration. Um, just like the Thiopental, it is also available in powder form and it must be reconstituted with sterile water. For small animals, we have the preparations available is a 1 to 2.5% solution. In terms of the shelf life is about 6 weeks without refrigeration, and this is considered to be more expensive than Thiopental. This is the dosage of the methohexital. So for methohexital, it is about 1/2 to 1/3 calculated dose IV over 10 seconds. So this is a titration of the dose, and this should allow intubation. Unlike that of Thiopental, so methohexital can be used with sighthounds, again because it does not accumulate in muscle and fat. It can cause a profound respiratory depression, just like Thiopental, excitement and seizures during induction and or recovery. So you can premedicate the animal with a tranquilizer, control post-operative seizures with diazepam, IV, and don't use in animals with epilepsy. Of the pentobarbital. So pentobarbital is of course a short-acting barbiturate. It is used to treat status epilepticus. So when we say status epilepticus, no, that is a seizure that lasts more than 5 minutes. So of course this is a life-threatening condition and this should be treated with, for example, an anticonvulsant, not to the dog, because this is lethal. This is, of course, largely replaced with propofol, no, because, again, pentobarbital has a very narrow therapeutic index, and it is, of course, currently used as a euthanizing agent. For the status epilepticus, so you have to administer IV to stop seizure and produce heavy sedation. That is for pentobarbital. Pentobarbital is provided as a 5% solution, so its onset of action is about only 30 to 60 minutes or 30 to 60 seconds IV. So that is very fast. And this drug has a very narrow therapeutic index. And again, this drug is more used as a euthanizing agent. Another general anesthetic that is commonly used is propofol. So it is an ultra short acting. It is non-barbiturate anesthetic. So propofol has been one of the most common injectable anesthetic in veterinary medicine. So this is a color white drug as seen in the diagram, and it is administered IV for anesthetic induction and short-term maintenance. It is indicated for small animals, small ruminants, exotic animals, neonates of all species. It is usually not used in large animals as it comes in little vials, and it is also quite expensive. For its other uses, it is given to bolus, no IV bolus, and titrated to effect, meaning that it can be given as a CRI or a concentrate infusion, and this is an option for animals that are in seizure, status epilepticus, and they need to be course controlled, through CRI, usually in micrograms per kilogram per minute. Again, we have here, our propofol. So it comes in, it is color white. And again, it is one of the most common general anesthetic, injectable anesthetic in veterinary medicine. The pharmacokinetic properties of propofol. So propofol is minimally water soluble. It is available in egg, lecithin, glycerin, soybean oil, aqueous solution, 10 mg per ml. So this is important because the egg component in it may facilitate the growth of fungus very easily. Hence, once a vial of propofol is opened, it is only good for 6 hours. Putting it in the refrigerator does not make it last any longer. It is of course milky in appearance, and it can be given IV. It affects the GABA receptor, just like the barbiturates. It is also highly fat soluble, meaning that it gets easily into tissues, including the brain. Its onset of action is about 30 to 60 seconds, so it is fast onset. For the duration of action, it is again a short acting, so it is 5 to 10 minutes. The complete recovery is about 20 minutes in dogs and 30 minutes in cats. Important pharmacological effects of propofol. So for the CNS, it can cause dose-dependent depression from sedation to general anesthesia. This means that it can cause sedation in low dose to general anesthesia in higher dose. It is not an analgesic, so it does not provide analgesia. Of course, most anesthetic agents do not provide analgesia. For the cardiovascular system, it is a cardiac depressant, just like most of the anesthetic agents, and it can cause a transient hypotension. For the respiratory system, so what it does is, of course, just like any other anesthetic agents, it can cause depressive effect with possible apnea or cessation of breathing, and it should be administered slowly to effect and monitor the patient carefully. The other effects of propofol. So in dogs, during induction, it can cause twitching. It has a muscle relaxant property. It is safe to use in animals with liver disease or kidney disease. It also has an appetite stimulant effect in lower doses. And it also possesses direct antiemetic effects. Now it's used for induction and maintenance of anesthesia, and it has also been associated with lower incidence of nausea and vomiting when compared with other anesthetic agents. It can also decrease the IOP and the intracranial pressure. Adverse effects of propofol. So again, it can cause, during induction, it can cause transient excitement and muscle tremors. There is also paddling, muscle twitching, nystagmus, opistotonus that can resemble seizures. So for the cardiovascular system, again, for the transient excitement, that can be avoided through giving a bolus of the drug. Then you have to titrate on the drug afterwards. For the cardiovascular system, there is a transient hypotension. And for the respiratory system, again, there is apnea or a cessation of breathing. Then intubation may be necessary in this case. For the adverse effects of propofol, so of course course, one of that is the seizure-like signs, particularly during induction. And this can be treated with diazepam. So diazepam is a benzodiazepine. No, it is a muscle relaxant, works well with seizures. Another is pain with IV injection. So perivascular injection does not produce tissue damage. So when we are going to compare that with thiopental, thiopental causes necrosis and sloughing of the injection site, particularly of perivascular injection. But in the case of propofol, it does not produce this tissue damage. For cats with repeated doses, so it can cause the formation of the Heinz body, particularly on the red blood cell. So when we say Heinz body formation, that is the condition wherein the RBC are being tagged for destruction, and it can result to the development of the Heinz body anemia. So it can also cause diarrhea and anorexia for cats and prolonged recovery. We also have the sight hounds. So the sight hounds or the propofol can be used in sight hounds, unlike that of thiopental. And propofol is safe in this breed of animals, but in the case of these sight hounds, again, it has a prolonged recovery. It can also be used with other breeds, but again, it takes longer to for recovery, that is more than 30 minutes recovery. Uses of propofol. So propofol can be given IV slowly, over given slowly IV after an initial bolus, 1 to 2 minutes to effect. If given IM, we only get mild sedation and ataxia, but not general anesthesia. The dose will depend on the premedication. So if we have given a good premedications, you also need a low dose of the induction agent to get to a plane of general anesthesia. It should not be used in hypoproteinemic animals. So again, the drug is highly protein bound. When there is hyperproteinemia, so there will be too much of the free drugs in the bloodstream. And it may cause excitement if given too slowly during induction. So for the administration of propofol, so again, you can use boluses. These are usually a third of the calculated dose, and this can be given every 3 to 5 minutes for 20 minutes. We also have the CRI, concentrate infusion. This can maintain the anesthesia for several hours, and this can also control the depth of anesthesia. For the recovery, again, for dogs, the recovery is complete in 20 minutes, cats, 30 minutes. And we also use, of course, premedication with tranquilizers. And again, this is advantageous because it can, of course, reduce the dose of the propofol. And it can also facilitate IV injection for uncooperative or unruly patients. For the handling and storage of propofol, so again, propofol is unique because it has a poor storage characteristics. Again, because it contains, for example, the egg lecithin, glycerol, and soybean oil, which support the bacterial growth. We should also use aseptic technique, meaning that, for example, we have to use a sterile needle, and the top of the vial should also be sterile. Of course, it is important to note that we have to discard the unused drug within 6 hours after opening, again, because of this property, because it easily spoils. And for the unopened vial, the shelf life can last for 3 years. This is considered to be more expensive than the ketamine, diazepam, or thiopental barbiturate.